All right, we are live. Let's go, Victoria.
Hello. Yes, we are now live, huh, Shirley?
Yes, we're live multiple places.
Yes, and uncut. uh, I'm hearing more and more people like the fumbling around in the uncut versions versus the polished look
Oh, well.
on YouTube. So we can literally say we're uncut. I'm excited, Shirley, because I think that the future of our profession in dentistry has a place in the medical world way more than the dental professions are aware of and understand. And my background as a dental hygienist for 25 years and understanding the role of our professional services has really blossomed in the last few years because of the internet and people and our patients becoming educated and wanting to learn more and know more about their health and their wellness care. And the joke was when it first got out there was, and my experience was, the doctor or the dentist or other healthcare professionals would say, oh, so the patient learned the information on Dr. Google. And and I never
In a
mocked
really
them.
disparaging term.
I never mocked them. And so introducing myself here on our podcast is my name is Victoria DaCosta, and I'm a dental hygienist practicing in a non-clinical environment, not cleaning teeth, but using my base as a dental hygienist in educating people who are very excited about learning how their mouth connects with their body. And they come to me for dental medical thermography infrared imaging scans of the whole body because I advertise that I help investigate the dental problems associated with the medical problems and fact find and take the time. I think that's the key right there. I'm not rushed.
It takes a lot of time.
I'm an independent contractor. I work out of wellness clinics, and I'm a certified clinical medical thermographer, CMT, but I'm also certified as a dental medical thermographer. And that's my story. And Shirley, go ahead, introduce you.
I am also a classically trained dental hygienist, and I graduated from my hygiene program in 1986, and I finished my baccalaureate degree in 1999 from Marquette University. And right after that, I was just like burned out from clinical dental hygiene. And because of the internet, I was able to express my views and express things that I don't know if I wasn't allowed to express them at work, but I certainly couldn't act on any of the things that I was learning. So I was invited to write articles for a publication, and then I was invited to speak to different state organizations. And that was very fulfilling. I was able to help other hygienists translate what they know into what they could be doing for their patient care. And pretty soon I was like, why don't you know this? Why don't you just go ahead and do it? And so I don't know. I'm one of those people that's driven by frustration. And if it's getting easy, I'll look for something to get mad about. So that's my little MO. And so I learned about the airway, which is a shock. Um, I don't know about you, Victoria, but I probably saw 10,000 throats in my clinical dental hygiene career. I never saw an
10,000.
airway.
I actually counted the years we've been in clinical, I counted
Yeah,
over 30,000 mouths I've been in. So
yeah,
I think that gives us a really
adds
trained
up.
and expert 30,000 mouths versus, the medical industry where they never look in the mouth and they
Unless the patient goes, I got this sore.
never, well, and if a dentist looks in the mouth, they're looking at the teeth. And,
The enamel towers, that's what they're trained to
yeah.
do. That's
Well,
what
and
they're
then
trained to focus on. That's what their licenses are supposed to do, they
right.
think.
And understandably, I feel for their pain because their license is very, and the dental board, very threatening, especially for the dentists who want to investigate more or bring more to the menu of their services. What we would like to talk about today is why this is such a fear. Why the fear of your scope of practice and not getting out of your vortex? Shirley talks about airway. How many times is airway that's been occluded by poor posture and just the way maybe a dental crown is placed on the occlusion and throws off the occlusion, throws off the neural sensitivity of number 9 hypoglossal nerve. Well, that little nerve is connected to other nerves in the brainstem that could really shut down other areas systemic in the body. And I think what we have here is a urgent situation for clearing the air of understanding that it's a team environment when you have a body in the chair. It's not
So
just...
I have a really good example of that just happened in the last 2 weeks. I saw a new patient, 18-year-old young man with his mother, who was a chiropractor, and he had braces. He was still wearing the braces, and he was scheduled to have his lower jaw surgery to move the jaw forward. She went to see a new dentist, who is how they were referred to me. And that new dentist took a CBCT scan. So we need all of these tools. We need the thermography. The CBCT scan is a 3D x-ray, so you can manipulate a bunch of different things around there. That x-ray was sent to an outfit that does with radiologists who read the actual x-ray. And then she goes, you know, this report says something about fenestration and dehiscence. And I don't know what that is. And why would a chiropractor know what that is? You know, why would anybody outside of dentistry? So I explained to her that sometimes with braces, the teeth get pushed out of the bone. She goes, well, yeah, but I get that, but there's 8 teeth involved. And I said, let me see what the report says. It was on the lingual side of all 4 upper front teeth and all 4 lower front teeth. And so it was pushed completely out of the bone on the inside. Okay. And I was like, trying not to be hostile. Because I was like, okay, number one, why didn't the orthodontist have this kind of an x-ray at this stage when he's just, 3 weeks away from doing an oral surgery? And I tried really hard not to sound slanderous. It's not my scope of practice to make any comments other than your tongue is in your airway. That's technically in my myofunctional therapy scope of practice because breathing is part of it. So I was really in a quandary. She's going to have to spend almost $80,000 to have one jaw surgery to move this kid's jaw forward, but he had 4 premolars extracted. So instead of developing the arches, they elected to make the arches smaller, which pushed his tongue back into his airway. So I put something on one of the Facebook groups and I said, what am I supposed to do with this? I'm afraid to even talk to this mother because I'm just so verklempt over this case. And there were 2 main things. One was I should talk to the actual orthodontist and she should talk to the actual orthodontist or find a second opinion for her. But one dentist who used to be a hygienist commented nicely, very, very nicely, I have to say, this is out of your scope of practice. If you're a dental hygienist, why are you even making any kind of comments whatsoever? And to exactly what you said, I responded to him that since we are all working in a shared domain, we have to be at least competent in everybody else's domain. Not an expert. This is why I'm looking for advice on how to proceed with this complicated case. But I'm like, this kid is going to get those braces off and he's going to have 8 loose teeth. It's that bad. So this is where we're at. It's a shared domain. We all have to be competent in at least a conversation with all of these different expertises, all of these different silos. We have to work with people with a permeable wall of their silo so we can have our information go back and forth.
Well, I believe where it starts is values, from what I've seen.
That's such a nebulous term. Whose values, the patients or the practitioners?
Both. If I want non-invasive procedures, I don't go to an invasive provider. If I don't
True.
care, if I don't care if they're in not invasive, then I don't care that the provider is not invasive. What's important is what's important to me, and we've heard this many times. The patient will be in the chair and say, well, they didn't even ask me about this over here, and this is what's important to me. They want to do over here, and it's their body.
So maybe you're calling it values and I'm calling it professional curiosity.
Mm-hmm. Well, I don't know if a patient, I have clients now as a dental medical thermographer, but I'm not treating, I'm investigating. And what I'm discovering is no one's listening. And what they're doing is
That's the other part.
they're
Yes.
treating symptoms, and they're not listening to what is being said. I had a case yesterday where she grew up on a ranch and she fell off horses all the time, and her tolerance was so high, pain, she never hardly ever felt pain. And her neck, when I scanned with infrared imaging, I noticed how locked up a lot of those compressed vertebrae were compressed in there. Now, when I finished her investigation, and it takes me quite a few hours, it's not something fast and a click. And I put some thought into it. And then I think about the providers who she could work with that will help unlock her neck or give her the proper healing pathway, because she's very focused. Her values are non-invasive. She's been told many times surgery and drugs. And she said, I don't want that, Victoria. That's why I'm here. I want to investigate and have the information. And I said,
Get to the root cause, right?
get to the root cause, and you are your own best doctor. So you hire us. And how do you hire us? You have to know about us and vet what our services are and how we care for people. Either we're going to care with the insurance mindset, or we're going to care with a more delicate and or what are our intentions? And I think the intentions are very much overlooked. And that's where I see the values is, what are your intentions? Are your intentions to help with, like we had our podcast with Dr. Smith, create a higher quality of lifestyle? And here she is in her early 70s, I believe. And she doesn't want to be using a walker when she's 10 years from now. She doesn't want to gum her food. She wants to be playing tennis with her grandkids, or her great grandkids. She wants energy. She doesn't want to have to take a nap in the afternoon. She doesn't want to wear adult diapers. Okay. So, I mean,
Simple pleasures, right?
yeah. I mean, it's so funny how they advertise, aging as, this is what you're going to have to just
Put
deal
your
with.
diapers on and go play tennis,
And
or
you know what?
pickleball.
You don't have to deal with it. That's what's so fun about it is when I take these investigations using my dental medical thermography investigation scans, yeah, the mouth is the first go-to to see where the medical breakdown is, because once the chewing is off and the proprioceptors on top and that the teeth are responding to, you're not getting that information into the brain. What happens is the brain can't send the signals into the organs. So that tooth and organ chart that everyone kind of mocked us about and said that's
Yeah.
a Chinese.
Oh,
No,
it
it's
just
not.
came the other day. Somebody was mocking about it.
Yeah, well, do the math. When your eye whites are yellow, well, people automatically, I haven't had one person not know the answer. Well, they say, well, that's jaundice, that's liver. And I said, but it's your eyeballs. What's your eyeballs got to do with your liver? And then they have to really think about it, and they realize, I don't know. And so I educate. So when you say, it's professional curiosity, I have it. The patient has their client or patient curiosity based on their interests. They don't want to be left in the dark without answers. and they're frustrated. The frustration level out there is so high. And for this
Very high.
teenager to have surgery on an area
Yes.
so close to the brain and without the neurology investigation and where everything is located, the side effects I've seen later in older when they're aged, and they have paralysis, they have swallowing issues,
Right.
and one of the things that they always have is pain. So, and they have a stiff neck. I mean, when you start getting in there and cutting, you don't know the micro branches of the nerves. You can't see them. But now you can see the side effects before you cut with the stresses with the infrared imaging, and that shows heat. And that's what we're gonna, talk about is where these hot spots are, which are really stresses on the nerve. It's nerve damage. So, in braces, I've been really educated about how much these braces can limit the circulation of the head and neck. It's not too great, I have to say. There's a
Right.
lot.
Plus there's four fewer teeth. And instead of moving all the teeth forward to fill that space, they pushed all of them backwards. And then there's no room for the tongue. So the tongue is forced to go backwards unless the mouth is completely open. And if the mouth is open, then you're putting undue pressures onto your jaw joint. Your jaw joint is not intended to be wide or hold the mouth wide open.
Right.
So that's a really important feature there. And there's one of the dentists early on in my airway journey that said that the teeth were there to hold the airway open. And that was in his mind, that's how important teeth are to the airway. And that's what he still says that.
Mm-hmm.
Do you know that your camera went off? Okay, there you go. Okay.
Well, what we have here is shared domain, and
Yep.
we have this concept flying around, oral systemic. Now the public is becoming more aware of oral systemic. Thank you, Colgate, way back when they said that heart disease and gum disease, it seems like every consumer knows that, and use our toothpaste. And that'll cure your gum disease and it'll help you prevent heart disease. And I smile at that now because it's so much more. And there's so much more information out there that, what I see is when we get into this, when we get out of school, we lose the knowledge of human anatomy. And when we don't have human anatomy, we see a piece of clay in the chair. And we see objects, and we see teeth, and we see, obvious swelling, or we see obvious symptoms. But the root causes, we're not looking at because we don't have time. We only have an hour, then the patient came late, and we've got to get the task done. And so we might do a little investigation if we have a conscience, right? And because we do care and we see something that's not normal, and it's abnormal, then we have our, the red flag goes up, and then what do? We pound the patient. Are you drinking too much or coffee or, and
Always blame the patient.
they're like totally, I hear so many horror stories about dental hygienists, and they're badgering the patient because of their lifestyle versus just making note and then ask some screening questions. Do it in a very refined, graceful way. And if the patient says, well, why are you asking these questions? Well, just some observations I'm making. Well, what kind of observations? Well, what's normal and what's not normal, because you're here, and you're in my chair and you're in my domain space, and I'm trained to look for things that aren't normal to help bring it to your awareness so that you have a way to care for yourself in a higher quality of way versus just come and get the car wash clean,
Yep.
And we have so many car wash places that are, the $5 car wash go through. And I really believe insurances have been a contributing factor to this, and taking the healing out of
Well, the people are separated from the cost of the care. So that's what they lean on. And then the price structure also gets unbalanced because you can keep charging more because the patient can't complain about it because the insurance covers it. And then we can't do it because the insurance won't cover it. And I don't not want anything without the insurance covering it. And it's completely wrong. The whole model is wrong,
you
this
go
third
down that
party.
insurance route dictating we need to
Yes.
know anatomy. And the orthodontist needs to know anatomy, the medical doctor, the hygienist, they all need to understand in using that CBDT scanner. That's great. I've seen it. It's part of my software in the DMT software tools that I'm using. But what I'm seeing is the Panorex gives me a ton of information. I used to never like the Panorex. I wanted a full mouth. Now I like the Panorex because I can see the rotation in the TMJ joints, the temporomandibular, and I can understand why there's a torque. Or I mean, I can see the torque and I can see it in the infrared imaging and overlay it. So now we have something to look at to see where the stresses are in the neurology. If they understood anatomy, I think it would help with the phases of care. First, maybe do body work and get the muscles released, or frequency medicine, and get the circulation up. There's so many added on care services that could even be brought into the dental practice. And I just, I was talking with a friend and I said, some of these fast food restaurants are known for their hamburgers, right? And just French fries. And I saw one advertising, I think it was Wendy's advertising now breakfast burritos. And you would say, well, that's a hamburger place. They shouldn't advertise breakfast burritos. Well, you just added on another menu service, and maybe people want a breakfast burrito for dinner. And that's just going to bring more people to the Wendy's, and then they thought about it, and expanding the menu in dentistry hasn't been done for like 50 years. And I believe insurance is a part of this. They said, here's your menu. Only serve French fries and hamburgers. You can't add. Now you go to Carl's Jr. or any of those fast food in Las Vegas, they're on every other corner. And I think because people live fast lives here, they want fast food. But it's interesting. I've watched the marketing and the change in their menu expand. And those the lines in the car are, the drive-throughs are extensive, although there is one that has a simple menu, but they actually added to their menu In-N-Out burger. People go in and out to get their burger for $5. But and that never line is down. I never see it. They have like two lines with their card.
It's a famous place. There's people out here going, I wish we could have an In-N-Out. I'm like, why? I mean,
but here's the thing is consumer demand. That's
yes.
what I'm saying. If the consumer knows they're going into a dental environment without pain and they have choice of menu, now you have a value. If the patient doesn't, I know as a patient or client does not value what you have, they're not going to ask for it. They're just going to come to that service, like your franchise dental versus your cosmetic dental. I get that, but still, we shouldn't compromise our care. And
right.
But I think it's always going to be compromised because they don't know anatomy. And if you change the menu service or be able to have the menu service, have at least the consumer, maybe there'll be a time that, In-N-Out Burger adds to their menu. Right now, they're in a productive, highly productive phase of selling something consumers want. And that's the key right there is dentistry hasn't been able to use capitalism in their dental environment due to insurances. And the patient comes in trained to say, will my insurance pay for it? And I want to say, you're paying for it, not your insurance. You're paying your insurance company and you're the customer to the insurance. So your insurance should offer more on the menu to cover the services you want. And so
perfect. I love that. Your insurance should be offering this. Why aren't you demanding it from your insurance company instead of demanding that I start taking insurance or lower my costs so that you don't have to pay so much? That is a much better answer.
Well, and you've seen it. Yeah, you've seen it.
Yeah.
And it's consumers need to be empowered with knowledge. And this is where, once again, I'm going to go back to the human anatomy, and this oral systemic link is so vaguely understood because they're forgot the anatomy. And And it wasn't until I started using 3D imaging software, anatomy software, that I realized, wow, this tooth and organ chart is really a tooth to organ chart. Like the organ in the liver is really a neurology pathway to the eye. So why can't it be to the teeth? Of course it is. So there you have it.
There you have it. Well, and we in dentistry have been so like, why doesn't medicine, talk to us? And, especially in the late 1990s when this whole oral systemic links really started to show up. And then they glommed onto it like, oh, we can finally save lives. And these cardiologists need to know that flossing is the answer to, cardiovascular disease. And the hygienists are running around going, floss or die, floss or die. And I'm like, holy moly, did you guys get the wrong answer?
Yeah.
You are just way off. You're on a little, but you're not, you're on the gangplank to the wrong ship, I guess, is is really the answer here. There's so much more. There's so much more that we need to be aware of and that we need to go back into our education and bring forward. We act as though if you flossed and put fluoride on your teeth, you will never have another problem in the rest of your life. And that is absolutely not true. It is so complex now. What did I just hear the other day? In the human body today, there's the equivalent of 3 bottle caps of plastic floating around in our bodies. And 10 years ago, it was less than 1 bottle cap of plastic. So what happened? And how is that interfering with how our lives are supposed to be? Okay, do I have a study to show you about that? Okay, let's just use the 50% rule. Let's say it's 50% right. That's a problem to have that much plastic floating around in your body. And you have to put that into your calculation. Is your patient intoxicated by these microplastics? Do we need to fit those into the discussion? If this muscle here, I know you've shown us a bunch of these muscles and that just are like on, like redneck was what you were talking about last week. So could it be that there's also an accumulation of these microplastics in there? And how do you know? And how do you find out? And do you just treat as if?
Well, you bring up a great point. And this is one of the areas that I've seen is, what's the solution? And in other words, if we're the experts and people are coming to us because we're trained authorities, why aren't we more educated? And why aren't we more investigative? And why aren't we taking more time to screen? Why isn't a microscope in every dental practice? Why aren't we checking saliva on every single person that comes in? Why don't we even just have a pH strip, for heaven's sakes? That's a 2-second, just stick your tongue on it.
But instead, we're poking the gums and measuring and then yelling about not flossing. And we're just trapped in this one solution and one diagnostic.
Well, it depends on what our intentions are. And fortunately for me, most of my years were spent in Santa Barbara, California. I don't know how much you know about Santa Barbara, California residents, but they're unique. Let's just say they're in a world of their own. They're not Los Angeles. They're not San Francisco. They're right in the middle of the state on the coast in a very healing environment. Looks like Little Italy. And they don't want to be discovered. I just put it on a podcast. But I grew up in that environment. So the people were very sensitive to being healthy and well. And they had an environment to live and eat and walk and talk and be happy in. They'd come into the dental practice, and my environment was, you better be a wellness dental person because I don't want these chemicals. I don't want the invasive care. I want everything healing. And it took me a little bit to undo the brainwashing I got in dental hygiene school to realize they were right. And I was wrong.
Idaho, right?
Because I kept
Talk
thinking
about
they
culture
don't
clash.
know. They don't do. They really are. Really don't know because they didn't get the training. Well, they're using common sense. If
What?
that chemical I can't swallow, and if I put it on a plant and it kills the plant, why are you putting it in my body? And then there were some of them that just very few, but they would accept the treatment for these chemicals and go along with it because they saw commercials or they, or were told in school, in their elementary school that, fluoride hardens teeth. No, it doesn't. And they have all the studies to show it. And I used to tell my patients, this is positive, this is negative, and it absorbs in the tooth. I mean, we were given so much information that was incorrect. And I fear now about all those people that I told to purchase ACT. And oh yeah, I had
Yeah.
them in ACT for years. You buy ACT, that's gonna, and rinse with ACT. And but you know what? Thanks to that environment, my patients started, saying, I don't want this, I don't want that. And I would have to find an alternative solution. And that's where I came up with my, Proganics all natural prophy paste. I had to. The patients didn't want any kind of substance that I had in my drawer. I,
Yeah.
I had to, and there wasn't anything I could purchase through a dental catalog. So I made Proganics all natural prophy paste, and patients loved it. And I started using on all of them, and they were all very happy with it. And I said fluoride free. And you know what? The internet is a game changer. So that's where I see in our continuing education courses, Shirley, is where either you and I are going to have to start offering those. And we can post them on Dr. Links and put our education in on your sites, but we need more information taught in this integrative world environment. They're
Yep.
not what they thought was just a short-lived fancy, whatever. You guys are it'll outlet. No, it's here to stay. Integrative.
I'm with you. It's we need to get the information out. This is one of the ways. The internet is powerful, and that's why there's always an onslaught. That's why in China they won't allow certain things to get through on the internet. And even in the United States, we see every couple of months there's a new whistleblower from some of the major sites that are blocking content. And I don't think it's as bad as it was. I somehow was able to find all kinds of alternative pieces of information to the narrative that saved, I think, myself, saved me from the first wave of COVID. I was the one who did all the shopping. My husband stayed home. He didn't care. And I was like, I can't just sit here. And so, you know, this is our opening here, and just being more open to different ideas. I know Dr. Smith was talking about frequencies and circulation. At Primal Air, we offer the beamer mat, so it's close to all of those things. It's just something that can really happen for patients here. You can rent it or you can just buy it outright. We're using ozone here for people that come into the office to help drain out sinus infections so that people can breathe through their nose. So, we do offer some other alternative things. And that reminds me too, I wanted to ask you, when you're talking with your patients about your findings after taking your DME, what was it, DME?
Dental medical thermography.
DMT. And I wrote it on the other side of my page. So we're here. So, sometimes I'm like, well, and then there's this, and then there's that, and then there's this, and then there's that. And it just sounds like a basket of too much information as I'm giving it to patients.
And it is, and they are TMI'd out. And
Yes.
so what the software does that I designed is, and I got this from the Germans because the Germans are the ones with the frequency medicine background. And also, we want solutions. So as people are watching our podcast, they're like, that's great. We know there's a problem, but what are the solutions? Well, the solutions are more education, but the right kind and from the right people, the ones that know it because they've been in it. And I've worked in over 600 dental offices because I temped. So every day I was in a different practice for over 2.5 years in the San Diego area, California. I saw so many systems broken. And I saw systems how people would come in and get their care and how they would not get their care. So having this, people teaching other people, or I mean, providers teaching other providers is going to be key factor on their experiences and what they've been through. So you can kind of get a shortcut version of what is the best route for higher quality of care. And learning on live podcasts such as our own, but really and truly, information management is a real problem because it's overload.
Us and for our patients.
And what they get is, I call it deer in the headlights.
Yes.
Done. So what I've done, and the Germans taught me this, is there's only 3 biosystems to investigate. That's it in the entire body with animals and humans. 3 systems, the biosystem, and I wish I had my charts up here, but we'll talk about it in another podcast. But I'm just casually mentioning this here. The biological systems that run the body. Your first biological system, biochemical. So you have the chemistry in the body, and that would entail, I say it to my clients, anything soft and mushy. So your blood flow, your blood, your saliva, anything liquidy, hormones, anything chemical wise. That's your organs. Your organs are chemistry. Anything that's going to have that could have a chemical change that a drug would change. Okay, that's why you have prescriptions. If you think about prescriptions, they're not adjusting your neck.
Right.
These prescriptions
they're blocking the electrical, which is one of the next.
They can't even block the electrical because the chemistry will block. They're what they're doing is they're not enabling the nerve to get the signal into the organ because they change the chemistry response. So that's why these drugs have to be so carefully analyzed with what I call biocompatible testing, materials testing, because biocompatible materials testing means your body is okay with it or it's not. That's why some people say, oh, I can't eat peanuts, I'm allergic. Well, yeah, your body chemistry doesn't jive with the chemistry in the peanut. So yeah, I would say that biosystem, biochemistry, we can adjust, and that's pH. We can look at the saliva pH very quickly with pH strips in a dental chair to see where they're at. Now, I want to point out, and this I did as a hygienist, if you put that strip in there and it's yellow, and you go around poking, like you said, with the probe, and that environment is full of anaerobic activity, you're just going to help spread it into the systemic part of the body through pushing it into the gum tissue in the sulcus area. And guess what? It travels. Those amoebas travel, and they like to travel and hook onto other cells in liquid. And so the chemistry is so important to understand in the body. Even the fluid in our eyes has chemistry, anything with liquidy. And so the next biosystem is biomechanical. And the biomechanical system is the actual overall infrastructure that holds the chemistry in place. You could say when you go to make cookies, that's pretty much chemistry with all those ingredients, but I can't mix it on the counter. It's going to fall out of the counter. So now we have a bowl to put the ingredients in. You have your framework, your ribs, your
neck,
yeah,
your teeth,
spine, yeah, and the teeth help to stabilize in the spine, the chewing mechanism. So your muscles, your ligaments, your joints, those are the mechanics that make everything compressed and move together. And when those mechanics are out of alignment or they're compressed, the muscles are torqued, there's so many symptoms with pain because of the mechanics. Pain in the muscle, cramps, that has to do with the next biosystem I'll mention. But the mechanics of the mechanical part of the body functioning. And I'm going to point something out after I tell you the next system. This
Okay.
is interesting. The next system is the bioelectrical. So you could have someone laying in bed in a coma and have their biochemistry regulated by the hospital and their biomechanics regulated, giving, but if the electricity is not going through the body or the brain, you're just pretty much a vegetable. So you have just a little bit of electricity. That's like when your cell phone, has less battery charge on it. You have to recharge it to get the juice going into it or use the battery. So the electrical, the neurology, and also the emotions. Energy, emotions. So emotions and the nervous system are under the bioelectrical system evaluation. So those are it. Those are the three systems. What's exciting is, and people don't understand this, and dentistry does not get it. Medicine, and this is here where you got to really, I want everyone in medicine and dentistry to understand this. In medicine, it's segmented. You have someone for nutrition. And I don't go to, someone who's going to work on my back. Usually chiropractors dabble in nutrition, but not really. Nutrition is very chemistry. So if you want to go to a dietitian or you go to your medical doctor, okay, medical doctor is going to talk chemistry only with the symptoms of chemistry in the gut, chemistry, they might look at all your and hear your symptoms, and it's really chemistry. The medical doctor's domain is. Now you got pain in your back. You could go to the medical doctor to get a pain pill, chemistry. But really that chemistry is changing the communication between the nervous system. So what we're doing is going to a chiropractor if we don't want to take drugs. I can tell you right now, it's up to 80% of these clients of mine, they don't want drugs. They want, non-invasive, non-drugs solution, more natural medicines. So then you go to your chiropractor, massage therapist, or body work to get the pain out. And then if you don't, you go to, there's two schools of thought, natural medicine and man-made medicine. Man-made medicine is going to cut, slice, and dice. And the natural medicine is going to help the body move the blockages and it will innately heal itself. So those three systems, electrical, chemical, mechanical, and electrical, are all segmented in the healthcare system right now. WellCare too. The only area where they're all integrated into one provider is, think about it, Shirley.
Are you going to say dental hygienist?
I'm going to say dentistry.
Okay.
Dental,
a little
dentistry
broader.
has dental tissue. Dental is really dental medicine. You have medical body and you have the medical mouth. Medical has all three systems. Think about it. It has the chemistry, it has the mechanical, and it has the electrical. And therein lies the whole area of investigation where things are showcasing and helping to assess the medical breakdown inside the body. Just like you look at the eyes and you see bloodshot eyes, or you see yellow eyes, or you see gray eyes. Gray eyes mean poor circulation to the heart. I mean, it's so obvious that the way the education system was set up, they didn't integrate. And they do in Europe. In Europe, you have to go into medicine to get your MD, and then you specialize in a DDS or a DO or, but medicine is your foundation. Understood. It's the whole person. But then you come to the United States, and I'm told by many providers and practitioners from other countries, United States has it so segmented care that you don't get quality, you get quantity. And the quantity is going to kill us. And I've seen it, just like you said, with your airway. It's going to put a kid in braces. What kind of thermal imaging evaluation did he have before he went into orthodontics? None. What kind of evaluation did he have? Palpation of the neck by in his dental hygiene visits, saying, you're really tight. Oh yeah, I fell off my motorcycle. I was in an accident when I was 14 off the motor scooter or whatever. And I bounced back because he's a kid. Well, he torqued the atlas. Remember we talked about the atlas. And if that atlas is off underneath the skull bones, then the skull bones aren't going to develop the way that they should, and muscles are going to tighten and jaw bones aren't going to develop. I see it all the time in the scans. And so what we're talking about is symptom care versus whole person care and understanding root cause. And that's what our system has been set on, to overlook these biosystems. And the biosystem evaluation is the cornerstone of getting to the root cause. And every single time I take these scans, I can tell you where the root causes are because of the teeth.
Because you're really looking into the past, into reserved traumas or preserved traumas of all of those biosystems that you mentioned and how they interact and react to different issues. So, for instance, when I take my health histories for patients, I ask them about their epigenetic changes. I ask them, was their grandmother born in a birthing trauma?
Which is smart. Yeah, right.
Yeah. Were they exposed to war? I mean,
exactly.
You know, my kids are in their 40s. Their grandparents were exposed to war and they're of childbearing age. So if their grandmothers in particular were exposed to war conditions with starvation and angst and all the stuff that was happening during World War II in Europe, then that's going to have an effect on my patient, the child or the grandchild, actually. So, I put that into the mix and I'm able to say to them, this isn't your fault and it's not your parents' fault and it's the government's fault. Who could argue with that? Between the improper diet that we were encouraged to use and all of these traumas and birth traumas that get carried out throughout life and how that is imprinted. We know for sure this is imprinted on the eggs of the women. As they're girls, they're born with all the eggs they're ever going to have. So everything that happens to that baby girl from birth until death is on the DNA of the eggs. And during that little window where these girls are able to have children, that damaged DNA or that tagged DNA, it's not always just damage, is getting foisted onto that next child, especially if it's a girl. It'll pass it on again and again. And until we honor that and until we take that into consideration, we're not going to solve the generational problems that are coming. And the closest thing we have right now is the thermography, the way that you describe it, to look kind of into the history of the person in front of you, which gives you an opportunity to ask questions about past, even past lives or whatever. I'm not going there, but in their history going back 2 to 3 generations.
It's interesting that you mentioned about that DNA because I believe from what the Germans taught me and the German doctors that were over here in the US 20 years ago when I was exposed to their thinking and their whole analysis of body health and wellness. One of the doctors after a conference I attended, he said in his German accent, Victoria, that all dis-ease, meaning apart from ease, is triggered by emotion, which is energy in motion. And emotions are a huge factor from what I see in these infrared imaging scans, the stress. Okay, it's going to happen. You got stressed 2,000 years ago. You had to stay from another group fighting another group and you didn't want to get an arrow in your back. And I understand that. Or, you were taught tonight, eat a poisonous plant, and the kid went over and found the poisonous plant and ate it and stressed out poisoning toxicity. So we all have stresses. It's the management of the stress I don't see solved yet. I see added on piles of it, generation to generation. And what is sad to me now is taking out that and there's a balance, a sensitive balance in life that, too much of one type of lifestyle over another could dominate the effect of another part of that, your way of life and belief system to be hindered. So you could look at the glass half full, or you could look at it half empty, and people say, well, that's just your attitude, which is true. But these types of behaviors, and even in my own family generational chart, the emotions passed on, programmed into the eggs, even how the mother carried me, my mother carried me, or how mothers carried mothers. I can see
Right.
traces through the generations going up into great grandmother, how they handled and managed stress, and they're either acted or reacted. And the sad part is people have more access to stresses. I don't want to say access, but they're exposed in these
More
cities.
stressors. Yeah.
Yeah, there's not enough balance, and so you watch TV all day to get your relaxation when you're not really getting relaxed. You're getting educated
Stressed, more
about it,
stressed.
more stress. So I see that and when I was practicing clinical hygienist, a person could, even in our wellness environment, running, eating proper organic food, and all these exercises, they look great when they walk in. You would think they look so healthy. I would look in the mouth and see all this inflammation and bleeding tissue without plaque. And I realized then that, we use that term, I don't know if you use it, but bleed like a stuck pig. I don't know where we got that, but I picked it up somewhere. And that in a dental environment can help save lives, because you could investigate where there's that blood. Even a mother told me one time, she brought in her 4-year-old daughter, and she goes, I'm feeding her good food and I'm flossing and I'm, not necessary, but brushing, and the daughter can't go and cook in the kitchen at 4 years old. So the gums were constantly bleeding. And, what are we going to keep reinforcing brushing? There's something systemic going on. And maybe the airway is closed off because of the way the daughter fell or birthed. Maybe she was birthed in a way that torqued her neck and the vertebrae, and it limited blood flow and oxygen to the brain. There's so many things to investigate in the dental environment that we can't add that breakfast burrito to the Wendy's menu, because I believe once the people are educated and know we could look for it, they're going to want it. And we talked a
I
little bit.
think they already know that we should be doing it, and they leave disappointed every time we don't go that extra little mile. Patients, like we talked about at the beginning, they are very savvy. They have access to information that they never had before, and different ways of thinking about things that they've ever had before. And a lot of hygienists just think they need to build rapport. So this is the 40th time they've seen this patient in the last, 10 years, and they're still building rapport. The patient doesn't want rapport. They want excellent care. And excellent care means sometimes you have to say things that you don't want to say. Like I had to have this conversation with this mother with this 18-year-old braces kid. I certainly didn't want to say any of that. I needed to watch what I said, and I needed to refer them on to a higher caliber practitioner to give them the real 2 cents.
This is where, and we're going to have a podcast about this, Shirley, this is where we need to, and Dr. Smith talked about this, really take a look at our scope of practice and our licensing and what we are allowed and not allowed, so that the bullying isn't there. I know I've been told by dentists when I started getting on and teaching this quietly, and I remember one dentist from Texas said, I would really like to go the route, but it's not in my licensing, and I will lose my license if I talk about oral systemic in the way that you're discussing it, Victoria. I can't do it. And I know Dr. Smith has found a way, because he's doing it, and he's in his 80s, and he's a dentist, and he's on these webinar podcasts, and he's just so going strong and happy because he's excited about more and more learning and discovering and educating his mind. And career options, this is what I want to bring up, is career options. So how can you have, and I want to talk about this, how can you have a clinical environment with non-clinical? And it's possible. You can get your license and credentials in another area of health, well care, I call it, and know that when you're switching your hats, your billing and every your services are going under this part of your career and your label, I guess, or your title. So now I'm a dental medical thermographer, RDH, comma, dental medical thermographer under that, and I'm a dental medical hygienist working with a team. The career option gives me now an environment that I don't have to be solo. And when I see these discrepancies in the healthcare, I can now work with a team environment to solve this issue or help guide the client slash patient into the proper care phases of care. And it's on their journey, not my agenda. I mean, I'm not gonna, it's like what I see healthcare now is you take someone walks into a Wendy's restaurant and you're there to give them whatever they purchase, and they want to purchase, a hamburger, and you say no, or breakfast burrito, and you say no, you have to do a hamburger because that's what
Hamburgers only.
hamburgers only, but it's on your menu, and I saw it online that you do have breakfast burritos. Yeah, but I don't think that's what you need right now because it's dinner time and it's 5 p.m. and that's a breakfast item. You really only need a dinner item. And
Yeah.
if the person says, but I want my body, I'm really craving eggs instead of beef. But that they're not listening to the patients, what their body is saying. And the career options could be and can be, and I did it, and you are adding on these certification licensing under the a title of in credentials of a different type of provider. So you're not just I'm not an RDH clinical anymore in that environment, but I'm an RDH. I have the credentials to show that I have the base of understanding when I look in your mouth versus and nothing and sat on about, RNs, but I've tried training RNs as dental medical hygienists, and it's not the same as training a dental hygienist as a medical dental hygienist because she's been in that experience. With an RN, I have better luck training them as a whole person thermography imaging, breast tissue and stomachs. That doesn't phase
I don't want to see anybody's boobs. I don't want to take chest x-ray or
right.
thermographies.
But I'm just saying that
Just wear
was
straps right down to here.
I can't tell you how many, quote boobs I've had to in the image, but
Yeah,
here's the
no.
thing, I tied it into the dome because it does connect, and you're gonna have to
I
someday
understand.
someone's gonna
That's
ask
somebody
you about
else's
that
department right now.
leaking
So we
liquid.
are like short on time. We have like 2 minutes left. So I
Wrap it
think
up.
this would be a really good topic for different careers. And maybe we could invite a couple of other people in that have
Absolutely.
also evolved their career from dental hygiene on or from dental on. I think that'd be really fun.
I think so too, and it's not only fun but needed. We need more
Well, yeah.
and dental
What are the
hygienists.
options?
Well, they have the base, and we have the base, and it's possible. And being leaders in the industry, we have the hours already. So yes, let's do it. Let's have another podcast about it and bring on someone that, I'm kind of a pioneer, aren't you? I mean,
Oh,
really,
yeah, I
I
guess
don't
so.
know too
I
many
didn't plan
hygienists.
on that, but
I didn't
so I
either.
just want to let people know, I know it's really a little bit short notice, but May 9th, I'm speaking in Chicago for what the heck is the name of the college, for a dental hygiene school down there. And I'm going to be speaking with, speaking of collaborative care, one of the speakers is a sleep physician, a pediatric sleep physician, an orthodontist, a pediatric dentist, a speech language pathologist, a periodontist, and we are going to Page College, and we're going to talk about working collaboratively. And then in September, I'm speaking down in Dallas for the Orthodontic Society. These are general dental practitioners who are doing orthodontics. And we're going to be talking about including the soft tissue and getting the tongue in the right place to help survive all these things. And if you want to know more about that or links to wherever I'm going to be, you can email me at practitioners@primalair.com. And you can also find out more about me and Primal Air at primalair.com. What about you, Victoria?
Well, I have the same. I'm not as famous as you, Shirley, yet, but I have been asked to then do some presentations this year, which I will start scheduling.
Super.
My site can be located at Dr. Links, and that's DRLINXS.com. And our podcasts are also posted there under Dr. Links under the Science tab. Also, as a career option, I would say look at my other site that I have posted, dntscans.com. And you will see that I have different appointment structures that I'm taking. And I really feel strongly that you're going to hear these collaborations, but we're going to have, there's going to be a need of how do you collaborate? Is it a phone call? Is it an email? Is it a blog? Or do you have a file on a case that they all are looking at the same on a Zoom call? That's something that next we'll talk about is what are the steps to collaborate with? Is it off a report that started where? In a dental hygiene department.
Yeah, we've got a lot of topics that our little topic list is just growing. It's not shrinking at all.
Like last week, he said that, didn't he? He said
Yep.
to learn now.
All right. Thanks, Victoria. We'll see you next week, I think.